welcome to Alberta Primetime. I'm Michael Higgins.
And I'm Shauna Randolph. The debris is all cleared and vacant lots are gradually being filled with new homes in Fort McMurray 2 years after the horrible wildfire tore through.
And while time erases the physical damage, there are still many mental scars for those who experienced the ordeal.
These images will forever be in the minds of those involved in the Fort McMurray wildfire of 2016.
Oh my God, be careful. I'm careful.
2 years later, as the community shows signs of normalcy, things are far from normal for many back home. More than 38,000 people from the region have contacted the Addiction and Mental Health branch of Alberta Health Services since May of 2016. Just how deep are the impacts of this tragedy to those involved? An associate clinical professor at the University of Alberta has some insight. And Dr. Vincent Agyapong with the U of A Psychiatry Department joins us in studio. He has been studying the mental health impact of the fire. Nice to have you here.
Thank you very much.
What prompted you to start this research?
Well, I worked in Fort McMurray full-time for 3 years prior to the Fort McMurray wildfires. I only relocated my practice to Edmonton a couple of months afterwards. And so Fort McMurray is very much a part of me because I have a huge client base there in Fort McMurray, and we had already been doing some research there. So with the fire coming up, we thought it was a good opportunity to continue researching the mental health effects of the fire, as well as continuing to support clinical service delivery in Fort McMurray.
Okay, so as we mentioned, it's been now 2 years this week. It's not so much in a daily news cycle anymore, but how much is this trauma of the event still a big part of these people's lives?
Well, we've done a number of studies. We did some studies 6 months after the wildfires, and we continue to gather data. In November 2017, we collected some data from a number of different groups in Fort McMurray. I'm not in a position to share the results of the data we collected from some of the groups, but I'll be very happy to share with you some we collected from out of our clinic in Fort McMurray. We actually found out that there are high rates of major depressive disorder, anxiety disorder, and post-traumatic stress disorder, as well as high rates of alcohol use disorder in the population who are seeking care in the out-of-hours clinic in Fort McMurray.
Okay, in general terms, what are people struggling with? Just some examples.
Yeah, for example, if we look at major depressive disorder, we found out that at least 1 in 4 of those who are seeking health care at the out-of-hours clinic fulfill the diagnostic criteria for a major depressive disorder. If you go into details, we found out that about 30% of those who reported that they had witnessed the burning of homes during the wildfire met the diagnostic criteria, compared to only about 12% of those who did not witness the burning of homes during the wildfire. If you take post-traumatic stress disorder, we found about 13% of those who are seeking care in the out-of-hours clinic fulfill the diagnostic criteria, compared to 0.3% who had a prior diagnosis of a post-traumatic stress disorder compared to the onset of the wildfire. So this is actually very telling. It means people are really struggling in Fort McMurray.
And perhaps hard for them to be in certain areas and, thinking back and all too.
Absolutely. We've seen quite a number of people have left the city. Thankfully, Fort McMurray is a very resilient community, and because it's a good place for jobs, new people are arriving in the city. But as a result of the wildfire, many people have kind of left the city.
Okay. In regards to the survey results, did anything surprise you?
Did not surprise me terribly, but as I indicated, this is a population of those who are seeking health care. It's not the general population, so we cannot extrapolate the data to say it's that percentage of people within Fort McMurray. It's only those who are seeking health care within the primary health care. But what's important is that, for example, if you take post-traumatic stress disorder, only 0.3% reported they had that diagnosis before compared to after the wildfire, which means there's been a significant jump in the mental health effects following the wildfire.
For sure. What sort of supports are available?
Well, Fort McMurray has currently, I think, 5 psychiatrists compared to 4 psychiatrists prior to the onset of the wildfire. There was no child psychiatrist before the wildfire, but currently there are 2 of the psychiatrists who've come to Fort McMurray who are seeing both adults and children as well. I know there was an increase in the number of mental health therapists in the city of Fort McMurray as a result of the wildfire. I don't have the specific details. Probably you can be able to get that from Alberta Health Services.
Right. What are your next steps then, working toward further interventions, Vincent?
So what we are trying to do is to basically highlight the mental health effects for Alberta Health Services and for policymakers. We have surveyed, as I indicated before, a number of different stakeholders. Dr. Peter Silverstein is leading the wildfire research into elementary and high schools. And we've also surveyed students in Keanu College. So we want to be able to put together the results, and then we'll share with the various stakeholders, and together we can be able to formulate an appropriate response.
How long do you feel people would need support going forward?
There was a study that looked at the mental health effects following the 9/11 disaster, and it was a study looking at 9 years after the 9/11 disaster in the United States, which actually indicated that there was not a significant reduction in the mental health effects. I mean, people continue to be plagued with depression, anxiety, and post-traumatic stress disorder. So if you look at previous studies, which indicates that people continue to suffer mental health effects a decade after the traumatic experience, then it means we are in for the long haul, and services and support will be needed in Fort McMurray for a very long time.
And what can others do that are close to someone, some loved one or a friend that is affected?
One interesting finding from our 6-month data was that we found that, for example, those who reported they had significant support from family and friends were about 13 times less likely to suffer from a major depressive disorder and 10 times less likely to suffer from a post-traumatic stress disorder compared to people who reported they did not have any support from family and friends. So I think this is the time for the community to continue to pull together to support one another, being it at your workplace, your home community, or people should just basically support each other. And if you are not in Fort McMurray, you have friends, you have family, continue to put in phone calls to them, check on them regularly, and find out how they are doing.
Not forget at this point. We appreciate that.
Thank you.
Thank you so much.
Thank you.
That is Dr. Vincent Agyapong. He is Clinical Associate Professor with University of Alberta, also Edmonton's own Clinical Section Chief for Community Mental Health with Alberta Health Services.